All right. So when you were talking about detoxing after implant removal, how do you guide them through that safe is that in a safe way, and or how do you even talk about that
Mhm.
topic with them?
Well, it comes up a lot. There's a lot of patients who like, how do I optimize my recovery after my implant removal? How do I detox? And I admit that this is sort of right outside of my expertise. I mean, I don't know enough about that. For a long time, I was actually kind of a minimalist about it. I do believe that removing the implant is sort of the biggest step in your detox. I mean, like that implant, the silicone shell or that, ruptured, silicone gel inside of your body can cause an autoimmune inflammatory response, and that propagates things. So just getting that implant material out of the body is probably the most important step in your detox that you can take. But that said, there's lots of other things that we can optimize. Maybe patients are even if they're not nutritionally deficient, they may be deficient in some specific vitamins and things like that. So my approach is pretty minimal. I typically say is make sure that everything else is good, like your nutrition is good, maybe supplement some protein while you're recovering. But let's just let your body catch up to this big step we just took,
Mm.
getting the implant out, and then see what happens. And if 3 months later, 6 months later, there's still something left over, then we can focus in on that detox. So that was sort of my approach for a long time. And having now recently spoken with a few naturopathic doctors, I think they sort of confirmed that. I think they were able to add a little bit more of their own expertise to the picture. Just like maybe, well, that's true, but maybe let's put them on this supplement and that supplement because that will sort of optimize how their circulation or their healing or maybe the lymphatic system. If somebody has a silicone ruptured implant, then I've noticed that on a few occasions their lymphatic system on the side of the ruptured implant can get a little bit clogged, a little backed up, so they get more swelling on that side. So somebody that does lymphatic massages is really key in our recovery because they can focus on that area and guide that swelling out a little bit better. There was one naturopathic doctor that also offered acupuncture for that same reason, or cupping, which I didn't even think about. But she said, like, well, cupping can expand the interstitium and therefore help with the lymphatic flow. So if you have that situation where you think there's like microsilicone particles in that lymphatic system that need to be cleared, this can accelerate the process. And I did not know that, but I do
Mm.
now. And this is another reason that we love to collaborate with them.
Yeah, and I think putting a little flag of caution from the patient's side, talk to Dr. Swistun about it. Don't just go off and do it with anybody who might be a expert or self-proclaimed expert in cupping or in anything. Like I think that's a good, you know, when the patients know that you're on their side and you're going to be open to that discussion, because some doctors don't want to talk about anything in the natural realm of medicine. Like
Hmm.
some MDs are not comfortable going over there. It's like quack
Yeah.
medicine to some doctors. So I think the patients even knowing that you're open to that, yeah, there's other things and
Yeah.
other interventions, and let's just make sure we go about it in the smartest way for you. And again, there's that concierge concept, not just for everybody, for you and what you're experiencing right now, and how to optimize that recovery process for you to get you to the goal that you have.
Yeah, I mean, like again, I think it just comes down to a little bit of humility. Is that like I recognize that I don't know everything, and there's lots of things that even science doesn't know that works, and maybe we'll find out in 10 years based on some landmark studies. Like, oh, you know what? This Chinese medicine trick that they were using that works for so many years. This is how it works. This is now we know why. That happens all the time.
Right.
So again, I don't discount other specialties. I actually find them very valuable, and I've seen so many patients have very, very positive outcomes from those interventions. And you just can't dismiss that. You have to include
Right.
that in your care.